Hi, Dr. Peter Petropoulos of Potomac Medical Aesthetics. Today I'm going to spend a few minutes talking about the options and therapies that we have here at Potomac Medical Aesthetics for sexual female enhancement. So let's talk about our options and what they do. The first option is something called the O shot, or people will call it the orgasm shot or the orchid shot. The O shot is an injection of PRP, or platelet-rich plasma, into the vagina using your blood, which is how we make the PRP, using special FDA-approved tubes to concentrate platelets. The platelets have the magic of growth factors. Growth factors are what we inject in order to stimulate your body's tissue using your existing stem cells to produce new, healthier, younger tissue. So what does the O shot do? The O shot is great for urinary incontinence. So if you have either urge or stress urinary incontinence, this is one of the best solutions for incontinence, especially after childbirth. It's amazing for this. Lubrication or loss of lubrication. Injecting PRP helps increase lubrication, which is oftentimes a very common problem as women approach the perimenopausal or menopausal years. Sensitivity, it really helps increase sensitivity with intercourse or stimulation. Another great effect of PRP is it can help the pain associated with intercourse because of scar tissue. Other conditions like lichen sclerosis are also greatly benefited, and sometimes even some chronic cystitis. PRP has an anti-inflammatory effect, which can be very beneficial. So PRP injections are what the O shot does, and it's really a great therapy for many women. What other options do we have? Well, if a woman is lacking in sex drive, there's a really common occurrence of hormonal imbalance, and many times that may be a loss of estrogen or testosterone, and it may require hormonal management. But if that's not the case, we have some other options too to help arousal. When it comes to arousal, adding Botox to the clitoris has been proven to increase sexual arousal. So when you couple the O shot to help improve the structural performance of the vaginal function, as well as Botox into the clitoris to increase arousal, that could be a very winning combination. Emsella is a pelvic floor muscle stimulator. It's the sister technology to something called Emsculpt. Emsella is a pelvic floor stimulator that really increases the muscle tone. It's like 20,000 Kegels in 28 minutes. It helps intensify the intensity of the orgasm. Emsella is super popular and very effective, and it also is very effective as an adjunct or as a standalone for urinary incontinence in females. It's a great combination to the O shot, and sometimes to the Botox that we can use. So as you can see, every patient may have a unique set of challenges. Sometimes one therapy may be all the patient needs, but oftentimes combining these therapies really produces the home run results. We see great improvement in the vast majority of patients as long as we are using the right therapies for the patient. These procedures typically last for about a year or two, but they do require ongoing treatment. But all of these therapies can be done together, sometimes the same day, but usually at the same time over the course of the treatment span. So we have been doing these therapies in this office since we opened. I've actually been doing injections for vaginal sexual health since 2013. I continue to be very involved with the industry and the PRP industry with ongoing continuing medical education, and every year we continue to find new advances in both techniques and offerings for females who are struggling with these issues. So experience matters, and these are the type of procedures that we have a lot of experience with here at Potomac Medical Aesthetics. So we look forward to setting up an appointment and treating you and seeing what options we have for you.